And Eric notes that the media always reports cumulative COVID-19 cases in the US or in individual states. And he wonders whether the general public should be concerned with cumulative cases. He asks, shouldn't the focus be more on the incidents in the past 30 days and hospitalization rates?
Eric is an epidemiologist, if he didn't know it already. Okay, you're absolutely right. That's what we follow. And even there, I tend to follow, more importantly, hospitalizations and deaths, even though they're at the end of the kind of pathway, you might say, the things that happened 3 or 4 weeks ago now being counted now, because they're one of the few things that are constant. Testing can have such an impact on case numbers. And so, as we've talked about many, many times, we're probably catching at best right now 10 to 12% of all the cases as part of our counted cases versus what's occurring in our communities. And so, if you could double testing, you could double the case number, and it still doesn't mean you know exactly what's going on. So I worry as we run out of testing in some areas, case numbers are going to start coming down, where then people will believe that somehow we've limited transmission, artificial. So you're absolutely right. We want to know incidents, first of all. We no longer, I sometimes, it makes me feel really almost kind of nauseated, because I still can't get over the fact that every one of these millions of people is a loved one, somebody's loved one. But we start to count them almost like the Dow Jones. The case numbers are up this much today. And what we need to do from a public health standpoint is know what's happening in the last 2 to 3 weeks. What is it? Is it going up? Really? Is it going down? And hospitalizations and deaths, unfortunately, are still pretty constant numbers for us out there. So I put that into context every day with when the new numbers come in. I try to look in the new numbers to say, where are they coming from? May not be quantitatively right, but qualitatively it really is important, because suddenly if we start seeing all of a sudden long-term care facilities again, or we start seeing certain work areas, or we start seeing university campuses light up, et cetera, that's telling us that something else is happening. And so, and again, that's only relevant within the last 14 to 21 days. So you're 100% right in your question. And it's what we try to do. And that's what we follow very carefully to understand what's going on.